Good afternoon. Today is January 13th, Friday, 2023. This is UMACO TV. My name is Kemal Erkan. We are going to go through our weekly events, weekly updates from COVID to global events and also U.S. economy. And we do also have some updates from the healthcare field, specifically from healthcare. So I'm going to let Sean join me now. Sean, how are you doing?
I'm doing fantastic. How are you?
Good. So, so this is the Friday the 13th. The only good thing is it's not the full moon, so I think I will be able to handle today.
Just a little bit of rain.
You know, the reason I'm not flying today.
Superstitious? That's because
So
of that.
that's why I bought a ticket for tomorrow. So now we are going to start with our COVID updates, and I know we hit 1.1 million total. That total is at 1.1 million for US.
Yep.
And I'm going to let our other computer in.
Yep. So while you get that set up, I'll just start here with our overview. Again, we're going to start with COVID. One of the things we've been following the past few weeks was the numbers and reporting coming out of China. We were suspicious and skeptical of some of the numbers they were reporting once they hit that one-day total of, I think it was 34 million cases, and then they stopped actually reporting on those numbers.
37 million.
37 million. Then they stopped on that. So we were suspicious that the number was obviously going to be exponentially higher in the following weeks or so from that one-day total. And what we're seeing here actually just released, I think it was yesterday or the day before, an article showing the satellite images of the actually crematoriums and funeral home in China, and the fact that they're actually expanding on the building, which just goes to show that the COVID death toll is actually having an impact on China, and the numbers that they're reporting may not be accurate after all.
It's definitely not. They're already telling us that they're not reporting, so I don't think they're hiding anything. So, but it's a shame that we have to kind of rely on satellite images to see what the damage is.
Exactly.
You know, the same thing that reminds me of the trouble when it started in Tigray. So we actually saw some of the issues from the satellite images. Like there were comparison from before and after. So that's how people understood that there was a bigger damage in Tigray. So this is now same thing for kind of for a different topic.
I think one of the things, some people actually need that seeing is believing to kind of absorb the message in its entirety, and some people if they just hear it in the news, there's a lot of cases, they may not necessarily believe it, but now we're seeing these actual images. You can put a picture to these topics we're talking about. It does help people kind of understand the magnitude. And then one other thing we're touching on here is actually the new variant of the XBB 1.5 that's responsible for over 40% of the cases as of late being reported. They're actually tied to that particular variant. And they're saying that variant is a lot more easily spread in between people. Although the mortality rate is not skyrocketed, it's still remaining relatively low compared to the other variants we did see. Again, we always compare it to the last winter's Omicron. When that first came out, we saw a surge in both cases and mortality death rate. But this new one is being spread a lot more easily in between people. And obviously the reminder that it is flu season, so you may be more susceptible to getting sick, run down, you're indoors, it's colder out. So
if you remember from last week, the November-December year-to-date comparison with 2021 and 2022, our internal numbers, we were at 4,150 last year for 2 months total. This year, in the 2 months, we are at 4,900. That's already an 18% increase from 21 to 22. So we just want to remind people this. And I see more people actually getting like flu-like symptoms these days than before. I don't know if that's, again, it's the season, that's one. But hopefully the January won't be too much. But we are going to actually report back on our own numbers as we complete the month, just like the way we do in our physician meetings.
Right. Yep. And I think another thing actually this year that was different was we did have that giant change in temperature where it was mid 60s for that week in January, and then plummet back down to back in the 30s. I think it's in the 40s now. So that change of temperature also does actually sometimes make people more susceptible to getting sick. So
absolutely, yeah. All right, so we'll go to our healthcare in the news. So
I can actually start us off here. We just had a couple of healthcare related topics in the news that we wanted to cover, at least mention here. Obviously, we know every Friday we also follow up this session with our Bariatric Friday. And, we like to provide as much information regarding the bariatric surgery weight loss program. And one of the things that was actually recently released in the news was the discussion of this anti-obesity drug now being administered to U.S. children. So we know that there are medications that are, it's already common knowledge of for some adults to be taking weight loss medication, which will either aid in their bariatric surgery, or if they're unable to actually undergo surgery, that is an alternative. But now this is a new talking point on the fact that it's actually going to be administered to children. And I think that just goes to show the severity of the childhood obesity actually becoming recognized now as a severe problem in the US. If you remember a couple of weeks back, we showed that map of, I think it was like a 10-year span on which states, I think it was like in the darkest red, had the percent of the population of either being obese, morbidly obese, and the fact that it was just increasing over that 10-year span across the US. But, it was most severe in the southeastern US we saw on that map. But again, it is a problem that's occurring across the entire US and needs to be recognized.
So now they're going to actually get more, I don't know if I'm going to use aggressive in terms of the actual term, but I think this issue that we discussed, as you mentioned, in our bariatric events, there's still the stigma and not understand the disease as a disease. Like the morbid obesity is a chronic illness. Mm-hmm. It's not a lifestyle choice. Some people are born with those genes, and then they are not able to lose weight with the traditional method that we use. So that's simple. So it's almost like there are people who may be able to control their diabetes with some miracles, but that's not the case for 99.9% of the people. So this is the same. And then now when we actually talk about pediatric, this is the population can go up to either 18 or 21, but let's take the 16 to 18. These people, they already completed their growth almost physically. So then any day that we actually waste is making the disease worse. Mm-hmm. So if there's something that can be done, it needs to be treated. There has to be a treatment plan. I mean, you remember our case conferences. So we look at these and we see the morbid obesity as patients chart, but there is no treatment plan.
Yeah. Mm-hmm.
So this is the same thing. So I would want that to be for my kids if I'm dealing with those issues with my kids. So that's kind of like how we need to take this. But I'm glad that they are understanding this better these days.
Yeah, I would agree. Yeah, that proactive approach, you want to get ahead of it. We talk about that in relation to, whether it's our COVID with the new variants, economy topics we touch on. That proactive approach seems to be universal across all these topics that we actually bring up in our session. So good to see that it's at least being addressed now.
So now speaking of pediatrics, so there's this new development, and I believe there may be more than what we see. This artificial womb, is it?
Yeah, so we did, I think we brought this up.
Yeah,
I think we mentioned maybe this week or the week prior, we did have a slide on it, but it is the artificial womb to actually, the main goal, I think, behind it, from my understanding and reading this article, was to actually mitigate pregnancy complications that may be occurred, with some women that are going into labor, or as well as the development process while being pregnant. But I think the thing that may be scaring some people is they might be lumping in the idea of cloning and picking out which genetic features they want to be expressed in their baby, and kind of the customization factor, which we're trying to, I think in the article they're trying to say it's not the case. Obviously there is cloning. We've cloned sheep, years ago. That is a thing in science, but for this particular device and plan behind it, it's actually more for a safety precaution. And
I think unless it's regulated really carefully, it can become a big problem.
Yeah, that's another thing too. I think they're saying this visual, it actually was a demo that they made because this doesn't exist yet, but in the video they said but as near as 10 years it could exist. And it was giving people reminders of the Matrix, where it's all these little pods of
Waiting to be born.
growing. Yeah,
That's like a little
So,
kid's
hatchling.
factory. All right, so the next update we have here is the telemedicine.
Yeah.
This is from Sanford Health, right?
Yes, this is actually focused out in the Midwest. But just touching here on the importance, this is the telemedicine, which are the patient visits that you can have provided to patient where they actually don't have to come into the office, which we know that was a big push during the COVID pandemic, where people who were maybe at risk and didn't want to travel into a crowded, visit room or in the waiting room of the office, where they're actually able to be seen from home and still have the same level of care as they would coming into the office in person. And also touching on our SDOH, which we always bring up in various sessions, the convenience factor of this and how it can actually help people who may have transportation issues. Maybe they have, childcare that can't leave, their children at home to make a visit, or any other various ones we actually touch on with our case conference examples, where maybe they have a caretaker or some type of issue going on where they're unable to make these appointments, as opposed to canceling them, having to reschedule. Maybe it's a delay in their care. The fact that we have telemedicine, telehealth visits available is actually a really big improvement. So we just want to touch on that is expanding in that one article.
Yeah, now, I am actually talking about this telemedicine issue. We are going to be very careful not to mention names of the patients, but speaking of the telemedicine utilized for the time that we have right now, the pandemic and the flu season and all that. So do you remember the pediatric patient who had autism diagnosis that father didn't believe us? And then we discussed this, I think, earlier this week. So, again, I was talking to the physician who's in charge of the patient as a pediatrician, and then also the other physician who's now the adult physician for the patient.
Yeah.
So we were going to discharge a patient. That's what we decided. Now, why we decided that? Because patient parents, they were in a denial, and that they were not coming for their visits. And then we felt like there was a liability for us.
Yeah.
However, when I talked to our pediatrician, Dr. Kara Roselle, she said, look, this patient has this mental issue. Coming to the office is a huge trauma. So we cannot penalize this patient for being in the office, not being in the office because they need to do certain follow-ups. This patient needs to be handled differently. And now as we are going through this update with telemedicine, I think that's the best way to maybe handle even for patients who may have those fears, those mental blocks. So we almost discharged a patient. This was, I know our case conference kind of early, but 8 a.m. So we may not remember all of the details, but because I just talked to Dr. Roselle regarding this patient, it's still fresh in my head. I'm like, telemedicine would be the perfect solution for a patient like him, because the patient is not getting any benefit for being in the office at that point. So that's another way of utilizing telemedicine. It's not just for the elderly who may have the infection and flu season. For everyone else, or the convenience, there's other actual necessity of situations where we can actually utilize telemedicine. That's why telemedicine is a must. And there is no way that we can actually even go back to pre-pandemic. That would be a disaster.
And I think with that example, it sounds like it was a win-win, because obviously from the patients and, they're getting the necessary care they need. It's comfortable for that patient, but also from our end, it's, there goes the liability of, there's no more no-shows happening. We're able to actually see the patient.
Absolutely.
Track the care.
But you know what she was suggesting? Well, we'll see him in Dover office because he doesn't know Dover Dover office is a physician office, so he's able to get out of the car. Like, so as soon as he comes into our Cerner office, he's not able to get out of the car because he remembers that. She even offered seeing the patient.
To have a novel location.
Yeah. I mean, like if you really kind of, because healthcare is not just like any other business, we deal with people's lives. So it's not just selling iPhones or selling tiles or selling furniture. It's very complicated, and you really need to understand what's happening on the other side. And the situational awareness is a huge plus if you are able to utilize it. But if you don't have that, you can actually get in trouble and you are not able to help people. So that's really important. Now, we have February 3rd, we have our Governor John Carney, who's confirmed. Originally, he was going to be on February 10th. He's going to be out, but then he's coming now on February 3rd. That's right after I come back from Turkey because we'll be out for 2 weeks.
Yep.
And after that, we have one of the state officials almost every month.
Yep. So we're actually getting Senator Poor with Dr. Barnett Smith to talk on menopause. That will be sometime either in later February or March, if not. And then, as you said, yes, state officials following up. Looks like roughly one each month for the next couple of months into the spring there. So we do have bunch of good topics and guests coming up. Yep.
All right. So now we're going to go to the global events. So let's start.
And so for our global events here, as we get that loaded up, we're actually focused a little bit more on just one topic this week, as opposed to touching on a couple few ones. We want to go a little bit more in depth on one, and it is one that is recently in the news, was on 60 Minutes on a talk show, and we feel that we wanted to touch on it and kind of dive a little bit more in depth compared to the usual one. So we want.
So this is a big kiss and tell, right? So this is we are going to explain why we think Prince Harry is such a loser. Well, other than betraying his family, we don't believe that he's being honest regarding being on the spotlight. So I think he loves the spotlight. He makes money from the spotlight, and he's not honest. That's why we think he's such a loser. So now, when we were actually getting ready for why we are talking about it, because everyone is talking about it, but also I see, well, we're a healthcare organization, and I see a patient who's struggling with mental issues. So, and then also media taking advantage of this person, just bring them on for every TV show just to promote their book. And then you look at this guy, he's just having shots with Steve Colbert, and he's with Anderson Cooper, he's with other people, telling about everything that he did wrong in his life, and he's able to get away with this. It's like I would probably call him like an entitled prick. So now we wanted to kind of explain this in a couple of different ways, and I do have a different, perhaps different approach on this from our view. So, like for us Americans here, it's pretty much it's a magazine, it's gossip. So like it's a cool story that the prince who's not really good looking, but still he's a prince, and then he's marrying to this still not so good looking lady. But then it makes a good story altogether, right? So, but when we look into the British monarch, many Americans may not understand. This is not just some style of government. This is monarch in England, in those countries. In the UK, is the head of the church. So the church actually reports to the king or the queen. So many people don't understand this. Why this is important is because this makes it like a religious organization. So if someone from the Vatican with the another big religious organizations, if their family members is doing something similar to this, would we actually really go after this and make them billionaires because he's becoming a billionaire soon? So that's where I see a big problem. There is this is not just some family issue. This is a big religious organization that's being actually betrayed by the family member just because he's not able to understand, or maybe he's struggling with all these issues.
Yeah.
So if we watched some of the videos, I know you watched some of those. I read so many books about his mom. Don't ask me why I did that. So I was studying English. So
you know why?
I watched so many documentaries about his mom. Where I was 15 years ago versus where I am today, my opinion is very different, because when we don't understand what was happening now, again, when I was explaining this to you, where this the family being head of the church, that gives you a different responsibility. So, and this is not just, you don't have to be a monarch to have this responsibility or accountability. As a CEO, I feel like I'm accountable and I'm responsible to make better decisions, because if something happens to me, I know that this is going to impact many families, right? Yeah. So I can't just do certain things that other people are able to do, or I can't do things that I was able to do when I was 20, 22, 24. Today is a different world, so we have responsibilities. So I think this guy is ruining not only his life, but a lot of other people's lives, and also that feeling of betraying your own country, like for what? Yeah. Like he had the money, so then mental issue becomes the problem.
Right. So yeah, as you're saying, we think that it actually is a factor in this, because the beginning of the interview, actually, if anyone has a chance to watch it, did start out the Anderson Cooper one I'm referring to on 60 Minutes. They did discuss, obviously, the passing of his mom, kind of how him and his brother dealt with it and processed it. Obviously, it was the same event, but they each took kind of two different paths on how they ended up processing, dealing with it, and where they are now into their adulthood. And, at the beginning, it touched on, how he wasn't able to mourn the way he felt he should have been able to, and that he was skeptical and suspicious of what really happened and wanted to open an investigation back up. And I think, as you're saying, though, as we're seeing him and his brother, the same event happening to them at the same time in their lives, both young boys, the fact that they dealt with it in two different ways, there must be some type of mental difficulty.
I think his father is not Charles. That's what the issue is.
There you go.
So,
yeah.
70% minimum. Mm-hmm. So, but anyway, I don't want to waste too much time on him, but the way that our media is making a big deal out of him is so interesting.
Yeah.
So, like, Dr. Erkan, fine, our events is more like, keeping things up to date with maybe a limited number of people. But Dr. Erkan, we do bariatric Fridays. I have a surgeon with me every Friday almost. We go out and then explain one of the biggest problems, health problems of all time. And then you see like maybe 5,000 or 6,000 or 7,000 people watching. And then you have this stupid gingerhead going out there and then talks about how he was killing people and doing drugs and, screwing older women and all these things. And then he gets millions and millions and millions of views. And yet his book is going to make more than probably 50, 60 million for him. Yeah. This is, I think we deserve it. So we deserve what we get.
Yeah, one of the other ones that did, another person that broke it down was kind of saying, some of the things that he experienced, traumatic, the death of his mother, but a lot of the other things that he was talking about in the book, it's like, that's daily life. A lot of other people are facing the same issues with, like a sibling rivalry, like that happens all the time.
I have that.
Yeah, so it's not this uncommon, like.
But I'm with me and my brother, we fought we still fight every day if you talk. And the solution is we don't talk. So
there you go. But you didn't, take this alternative route of to try to cope or maybe take advantage of, obviously.
From the media standpoint, Sean, I think what I see after watching maybe 3-4 of the interviews, I don't believe he's healthy. So wouldn't you think that media would be a little bit more careful, like doing a tequila shot with him when he was struggling with addiction issues? Like now and people who are watching this, what kind of message are we giving to those people, families with younger kids watching this show, and they are going to take a shot while they are doing the interview? Like, and he didn't write that book, so someone did it for him, which is fine. I'm going through the same route for. So I'm going to change my content. I'm going to put some Jewish stuff.
There you go.
Otherwise, it's not going to sell. So
you got to learn off of this.
Right? So I mean, but fine. If you want to be out of the spotlight, don't write a book about your
right. Oh, paradox right there.
or don't go to Oprah, or don't marry to the movie star. Like, you have a lot of ways of doing things.
Yeah.
I mean, he had a kind of like extended family in Africa, so he could just stay there. Like, if you don't want to be seen, you don't just go out of those places. That's simple. But I think there's still mental issues that's not being addressed properly. That's at least what I see, and I think more trouble is going to come out of that guy because that's not going to go away. I mean, I since this is going to be on YouTube, so then I'm kind of tired of telling people "told you so," but I don't think they're going to get away with this. So I mean, it may not be like too long to see some disaster, and they're asking for it, honestly. And I'm not saying I'm agreeing or disagreeing, but I can see some really big trouble coming to their way. Anyway, let's go back to our real issues. So real issues, because what's happening today is average American who's about 64 years old, they have to work 3 or 4 more years because their retirement funds are melting. They already down by 20 to 25% from year before. So someone who's 64, who was about to retire at age 65, now they have to work 3 or 4 more years. While we are still talking about Joe Biden's Corvette in his garage. But the garage is locked, so we are okay, so we are safe. Now, let's actually talk about what this means for average person, because this is a lot of our patients. If you look at our patient population, we have probably more than 30,000 people who are either Medicare age or it's about getting to the Medicare age. So what's happening, what this means, and why we think this is kind of not being highlighted by media. So what do we have there?
Yeah, so just to touch on some of our previous sessions, I keep saying this, but when we did cover the finance and regarding the retirement funds, we did mention the proactive approach and the fact that a lot of people actually don't accurately estimate what their cost of living would be and how much they need for that retirement in the first place. So just putting that aside, the fact that even if they did have an accurate number right now, the market dropping 20-25% in the last year, if you're saying 8% return on average, if you're following the S&P or the Dow index on a year return of 8%, if you lose 20%, you need to make back 25% to cover that loss.
You have now lower base.
Exactly, because if you make 20% back, you're not at even anymore. So that's where we're getting this number where 20% deficit, you have to make back 25%. So 8% on average a year. Look, there's 3 years right there. You'd have to wait. And that's if it continues at the average return. It could continue to drop as we go into 2023 here, which again, it may be more than 20% then, and even longer you have to work to make that back up. So
now we are talking about the average Americans, and let's actually just maybe I think the from the statistics, people's income, how much they are making. So someone needs 260,000 to retire.
Yeah, obviously there is
someone who's going to rely on the Social Security income.
Yes,
that
in addition,
right?
Yeah.
So, but then for being comfortably retired, so you need a lot more than that.
Yeah, if you want to, entirely eliminate that sense of worry that may creep up, it would have to be much more than that. Obviously, it depends on what people's lifestyle habits are, what type of retirement they're looking for. Is it going to be a modest stay at home? Maybe.
But also how long they're going to live.
That's another thing too.
Like life expectancy is increasing. So the retirement age 65 was based on the baby boomers because they were not making it until they were 70. So then a couple of years before you die, you retire. So now that's longer.
Yeah, and now with the healthcare advances, like you're saying, life expectancy is now longer, but also think about the cost of that healthcare for elderly people when they're maybe on more medications they weren't on when they were, in their 50s, for example. So now you have to factor in these other elements to be, withdrawing from that retirement. And the fact of once you retire, it is a fixed number. You're probably not going to get a raise from your retirement once you go into it.
No,
It's going to be,
I mean, this is, but why actually, the other reason that we are actually bringing this up again is we look at the inflation, we look at like what it's 8 to 9% now, which is a lot higher than what it was. Now, I say this, in the United States, the inflation rate is not 8%. That number is a very well modified number, crafted for public. The inflation is at a minimum 30 to 35% at a minimum. So how it's impacting our day-to-day life is more than 35%, I would say. Now, on top of this, we people who have retirement funds, they lost 20 to 36% of that. So now you'll make up that difference in time.
I have time.
I'm still young, so I'll make up that difference in time. That's why we are kind of focusing on someone who's about to retire. How this economic crisis impacted these people's lives is because now they have to make decisions on their retirement age, so they won't be able to retire at the time that they plan.
Right.
So that's why actually the big part of this economic recession that we are going through, the big part of the impact is actually on those people who are over 60, because they may not be able to make up the difference. Therefore, they have to actually end up working longer to make up.
Yeah, it's just running the numbers at that point where how much duration they have, and then as you're saying with that life expectancy, you have to factor in also their plans for retirement. I said everyone's lifestyle is different. Maybe someone was planning, I'm going to move to Florida once I retire and be able to buy this house. Well, maybe
remember, we don't want people to go to Florida because they're
inland Florida.
Inland Florida, okay.
Yeah. But as we're saying, like that retirement, if you're down 20%, that's significant numbers. And that's just what we're seeing as an average. It could be worse depending on what type of retirement plan, and
absolutely. And this is something that you have to really start early in life to actually get to that. And that's why you have to have that discipline to be able to put X% every month of your income. And then you need to forget about it for a long time.
Yeah.
So then you don't have to really be one of the average people. So you can actually have a comfortable retirement.
And this sense of worry wouldn't even impact you, hopefully, at that point, if it ever did happen, when those people are then turning 60, 65. And I just want to touch one other thing, with that. Some people may say, oh, well, if my retirement's going to go down, it could drop, I could lose all my money. I'm talking maybe like younger people, mid, late 20s, early 30s, who are scared maybe of investing. I would say this is actually a great time, since theoretically all the stocks are on sale. This would be, want to buy low, get more bang for your buck right now. And then also just comparing, there was one visual there on the slide where the savings account, where if you're contributing the same amount to a low yield savings account that gives you, maybe like 1% return on your money. Think about that. You're loaning your money to the bank to use, and they're going to give you a kickback of 1% for leaving it in the bank for them to use. Whereas if you put that in index, it may go down, a year to year, but in the long term, it's actually going to be a lot more beneficial for you to get in an index.
Exactly. Our point was that's why we were kind of focusing on people who are over 60. In fact, people who are about 64. So how it's going to impact them, rather than how it's impacting you or me. I'm going to be 49 this month. I know that I'll make up the difference because every 10 years you are able to recover from big losses. But people who are at the age of 63, 64, they're going to actually make changes in their plans. All right. So now there is something that I do want to bring up. This is with Delaware. And interestingly, this is not actually being shared yet. So let me actually take this. All right. So there is a leadership trouble in Delaware hospitals, and I shared this last night, and I was trying to see if there was anything public, any public announcement, and there wasn't. So now, why this is important is because this is one of the biggest nonprofit organizations in Delaware, one of the biggest employers after the state of Delaware. Over 2 billion revenue, and so many people rely on this organization for their healthcare. But as a nonprofit organization, when they have to let 2 of their top executives go, I think that's kind of like alarming. So I believe public needs to know these because it's a nonprofit organization. So this is important for those people and others and their employees. So I don't know if some of their employees know about this. So, but I thought this was interesting that Christiana Care did not share any information about the top 2 people leaving. Now, I'm saying they are terminated because when you get an email on the day of termination, and if that's your last day, you are terminated.
Yeah.
So you didn't quit, right? So interesting. Now, the other one is I see some issues with St. Francis Hospital. St. Francis Hospital, as you guys may know, they're part of Trinity Health. Trinity Health is like a $22 billion organization, but St. Francis is a very small fish in that organization. Now, St. Francis is extremely important for Newcastle County because that's the only other alternative to Christiana Hospital. So the monopoly of Christiana is already affecting the cost of healthcare, and we don't want St. Francis to go under. However, their leadership change, where they have a regional leadership, they don't have a CEO at the hospital anymore. So they're all done by Philadelphia. So they are part of 5 hospital systems for Trinity, which is very problematic. And I'm worried about St. Francis. If you remember, we talked about their trauma program.
Yep.
I have done so much for St. Francis in the last several years. And I'm just worried about, the mistakes that's going to impact people who are relying on this organization as well. So it's kind of scary and interesting at the same time. So we have our Bariatric Friday event with Dr. Erkan, and we are going to talk about sex and morbid obesity.
In that order.
And many people, many organizations, they shy away from these discussions. This is a healthcare organization, and we have to address all problems all together and then make sure that we understand what's happening in people's lives. So we'll talk about obesity and sexual health in 15 minutes. So we'll be out for 2 weeks, and we'll be back with Governor John Carney on February 3rd, 2023.
Correct.
So until February, please stay safe, and then thank you for watching us.
Right.
Bye-bye.